Have you or a loved one been diagnosed with sciatica and wondering if chiropractic care can help you? Have you been told it'll get better over time and you've had appropriate care but it's not getting better? Hi, I'm Dr. Matthew Collins. I'm a chiropractor. I'm board certified in rehabilitation and fellowship trained in primary spine care. In addition to my training, experience, and education, I've been managing for decades patients with the diagnosis of sciatica. Now please note, these videos are not a substitute for professional medical or chiropractic advice for diagnosis or treatment. These videos are for informational and educational purposes only. Seeing the wrong doctor can result in an incomplete diagnosis, wrong treatment, and persistent symptoms with poor recovery and unfortunately sometimes no recovery. So let's jump in on this topic of sciatica. Now, technically the phrase or term or diagnosis, however you want to call it, sciatica refers to leg pain. We see a lot of patients that come in with leg pain and they do not have sciatica. Allow me to explain. There are multiple tissues that can cause pain going down the leg. The most common one that most people think of is sciatica, which is inflammation and or compression of the nerve in the lower back called the sciatic nerve, which comes from 3 or 4 different levels in the low back and goes down the leg. Compression can give you pain. Inflammation of that nerve can give you pain, or a combination thereof. So I have a model here that I'm going to demonstrate for you. So this right here, these little bumps right here are the bumps that you would feel on your back. These right here are the roots of the nerves that are coming out of the lower back, and these would course and go on down the leg. Now, several of these nerve roots come out together and then form the sciatic nerve, which goes down the leg. So there are tests that can be done to determine if the pain is coming from the nerve. However, there are some conditions very similar to sciatica that mimic sciatica that would give you nerve pain. One of them is actually the joints. This right here is a healthy joint. This right here is a red and inflamed joint. Interesting. These joints, when they become inflamed in the low back, these will radiate pain. Most of the time, joint pain does not go past the knee, meaning like it'll radiate down, it'll go into the glutes, it'll go into the thigh, but it doesn't go past the knee. Many times, sciatica will go all the way down to the heel. If there is problems at where the nerve roots come out, it is possible not only to have nerve root problems, you can have nerve root and joint at the same time. Now, holding these bones apart right here are called the discs. Discs themselves, the more painful they become, the discs themselves are alive, they can give you pain. A disc can give you pain going down the leg. Here is another model showing the disc. And here's a helicopter view looking at the disc from the top. This disc is alive, like I said, and if it's giving too much irritation in there, a person can also have pain that goes down the leg. Last but not least, there are muscles that attach to the spine. Like this little muscle right here attaches to these little bony projections. Muscles, if they become hard, tight, and fibrotic or painful for any reason, they can refer pain into remote locations. Low back musculature can refer pain into the glutes and, you guessed it, into the leg. Unfortunately, there are some conditions, for example, some degenerative conditions where the disc starts becoming painful. The disc degenerates, the space collapse. There starts to become some joint pain. So now we have some disc pain. We have a little bit of joint pain. And then at the same time, as the disc collapses, it puts pressure on the nerves. So you start having some nerve pain. The muscles have to start working harder and harder because the joints are getting stiffer and stiffer. This combines into a very unhappy combination of disc pain, joint pain, muscle pain, nerve pain, and these patients can have pain going down the leg. If you treat only one of the pain generators, such as the muscle pain with massage, so to speak, or muscle pain with exercises, but you don't treat the others, you don't get better. So what is the solution? The solution is having a thorough musculoskeletal exam. So if you or anybody you know is struggling with leg pain, have been told that you have sciatica or suspect that you have sciatica, you should get evaluated right away. Give us a call at 651-925-5530 and we'll be happy to see you and evaluate you. Once again, you have many videos to pick from. I'm honored that you picked this one. I hope you found this information helpful, that it increased your ability to make better decisions, and until next time, be blessed.